Hi, everyone. I'm Dick Deming. I'm Medical Director of Mercy One Cancer Center and the founder of Above and Beyond Cancer. Thanks for coming to our weekly cancer education series. It's brought to you by a grant from the Rosalie and Sherry Exline Ziegler Fund. And tonight, you're in for a treat, and I'm in for a treat. One of my friends and colleagues from the University of Iowa is our guest, and our guest is Dr. Susan Lutgendorf. She is a PhD in psychology. She grew up in New Jersey, got her undergrad degree at the University of Chicago and her PhD at the University of Miami. She is the professor of psychology and the Starch Faculty Fellow at the University of Iowa, Department of Psychology, Gynecology, and she's also a member of the Holden Comprehensive Cancer Center and a friend of mine. Welcome, Susan.
Thank you very much. I'm happy to have an opportunity to have a conversation with you.
Yes, and we're going to talk about some work that we collaborated on. And the topic tonight is about growth and resiliency in cancer survivors. And but before we get into that, tell us a little bit, Susan, about your interest in psychology. When did you first realize that that was an interest that you wanted to pursue up through a PhD?
Okay, well, actually, my interest in psychology goes back to high school, and I was very interested in experimental psychology at that point. I was interested in neuroscience and learning and memory, and as a high school student, I went up to the Jackson Lab in Bar Harbor, Maine, and was studying learning and memory in mice. And then I think it was after my undergraduate degree, I got a degree in social work, and I started working as a psychotherapist. And I became aware that I wanted to learn to not only support the people that were in front of me that needed help, but I wanted to understand interactions between the mind and the body from a much wider perspective. And to do that, I needed to do research. And so I went back to graduate school then at the University of Miami. I already had kids at this point, and got another master's degree and a PhD and then a postdoc in studying psychology. And it was actually a combination of psychology and immunology in an area we call psychoneuroimmunology.
Right. And so it's really how does the processes of the mind affect our physiology? And this connection between, well, maybe say a little bit more about, we sort of talk about this mind versus body, and obviously we are one organism, and what some of us might put into the thoughts of consciousness or thoughts actually are part of physiology and can affect immunology, and you can actually study that. Wait, tell me a little bit more about your understanding of the mind-body division or assimilation, maybe.
Interaction is a better word for it.
Okay.
Actually, Descartes, in whenever it was the 16th or 17th century, was the one who put the dividing line between the mind and the body, and which unfortunately much of medicine has been based on. But modern science has seen very strong relationships between mind and body in cardiovascular disease, in diabetes, in cancer, in dermatologic diseases, you name it. If you look at stress hormones, very often they will aggravate the disease, various diseases. And much of my career has been spent looking at ovarian cancer and looking at various pathways by which tumors support ovarian cancers becoming more aggressive. And that has been looked at in breast cancer and prostate cancer. So there are some really quite well-established pathways at this point, and it's a fascinating area.
Yes, I an analogy I also often use is, let's say you step outside of your back porch to take the garbage out, and a dog jumps out of a bush and barks at you, doesn't touch you. I mean, we can feel instantly this physiology that is happening because we've had this conscious thought. Well, some of it is maybe subconscious, but this fear that just comes to our body, and our heart starts beating, our mouth gets dry. We just feel this intense physiology. Um, the opposite thing happens, that we just don't feel quite as intensely when you see someone's face that you care about, and there's a very powerful reaction that isn't quite as intense for us to notice, but our heart rate slows, and there's these mediators that I'm sure you'll talk about that help relax us and give us a sense of calm. And all of that is because we consciously saw something that evoked something in our brain that resulted in transmitters causing all sorts of physiology to happen.
Yeah, and I think to your point, when you think about someone you love, or you think about loneliness, or you think about despair or depression, they're not something up here, in the atmosphere. If there's something that you think, there's something that you feel that go through your brain and your nervous system. If you have a stressor, you evaluate, can I deal with this? Can't I deal with this? And all that starts a cascade of stress hormones in the body. And so all these emotions that we have are embodied. And if you have stress hormones in the body, or on the other hand, if you have hormones like oxytocin because you're seeing somebody that you love, um, those all have downstream effects on all of our body systems.
Hmm. Yes. And we're going to talk about some research that we collaborated on, looking at, and we're going to talk about the concepts of growth, like personal growth and resilience. Maybe before we get into talking about the study, to maybe give us a bit of perspective on what do you mean psychologically speaking when you talk about the concept of growth or resiliency?
Okay, well, I think what I'll do is just back up for a second and say so much of psychology or modern psychiatry is devoted towards essentially mental health issues, decreasing distress, decreasing anxiety, decreasing isolation. And all those things are really, really important, particularly now after the pandemic, or, as society is changing. But one of the things that is just emerging in the study of psychology is what's called positive psychology, where people are looking at what is well-being and how do you enhance well-being. And the processes of growth, like growth has to do with being able to open up, experience life in a different way, be able to have different and more open and more fulfilling perspectives on your life. And resilience usually refers to people being resilient after some kind of challenge has happened, after something difficult has happened. Um, and so it might be resilience after a cancer diagnosis, resilience after a trauma, resilience after uh, COVID. And so we think of growth and resilience and enhancement as things that really can be important for quality of life.
Yes, and I like where you point out that for most of the study of psychology, it was looking at people who weren't functioning optimally, and how can we fix something. So even when we say mental health, most people think of mental illness, um,
Right, right.
and even the phrase mental health sounds like it's somebody's got a problem, whereas mental health has a positive side, and there are ways of having better mental health, just as there are ways of having better physical health.
Yes.
Um, Probably everybody listening to this talk has heard of post-traumatic stress, going through a difficult time. And by going through the difficult time without support, you come through that difficulty with less ability to maybe handle normal stress. But I have witnessed, and we're going to talk about the concept of post-traumatic growth, where people who go through a challenging experience, but with the proper support, may actually come out the other end with a greater sense of confidence and have resilience, the ability to actually spring back with a better a way of dealing with future stress, because they know they've gone through it before, they've come out the other end, and they have a greater sense of confidence. What more would you add to that concept of post-traumatic growth?
Well, I think it's a really important concept. And I think you see in your work, I see that over and over again, that while people are going through traumas or really stressful challenges, they're they're terribly challenging and distressing. But if somebody has the proper support, or is able to manage and maneuver through that, very often it makes them much stronger. And it also puts them in a position where they can help other people.
Yeah. And you mentioned that there's this field of psychology that's often called positive psychology. Maybe give us a little bit more perspective about when that term came into being and what is encompassed by that phrase, positive psychology.
I don't know the whole history of positive psychology. It's been around for a while. There is a professor at Yale who teaches a class in positive psychology, although it's not called exactly that. And it's probably the most popular course on the Yale campus. There's another one at Harvard like that. But like people are really looking for that. People are really searching for how to make your life or how to make our lives more deeply fulfilling.
Hmm.
Um, and it's been an important adjunct to everything we study in psychology.
Yes, and just as we, over the course of the last 30 years, there's been an emphasis on how can we make our bodies better, healthier through eating, through exercise, through yoga. How can we enhance our lives? It's natural that we start looking at not just how can we make our bodies better, but how can we make this thing we call our mind, which is part of our body, how can we also um, do practices or diet or stress reduction that can actually improve our overall sense of well-being from a
Hmm.
mind, body, and spirit perspective.
Exactly.
So let's talk a little bit about how we got together to collaborate professionally. So, as many of those listening know, with Above and Beyond Cancer, we take cancer survivors on challenging transformational journeys, often up into the mountains. We absolutely guarantee that there will be challenges and suffering along the way. Whenever you're sleeping in a tent at altitude, there is discomfort, there is stress, and there along the way is being homesick, feeling um, insecure, but we do it as a group with lots of support. And the whole premise of these journeys is that in the process of doing something team related that includes difficulty, that it parallels the cancer experience. It's challenging, but there's support. And in the process of coming through this together, that you have a positive experience, even with the suffering, with the support, you come through with this positive experience. So we were interested in not just having anecdotal people saying, oh, that was amazing, it was so difficult, but I feel so good. But we wanted to see if we could study it and actually provide some evidence that what people are telling us is in fact true. So let me turn it over to you, and as a scientist and as someone who does research, what was your thoughts when we first had the conversation about how one might test the hypothesis that taking cancer survivors on a challenging trip like this could result in post-traumatic growth or a positive growth experience?
Well, so I think I actually heard you talking on the radio one day, and I said, I need to get in touch with this guy. and and I mean, the whole idea was really to it seemed like, well, so first of all, there are so few studies that look at how to enhance growth, how to enhance appreciation, depth, transformation, whatever you want to call it, in cancer patients. There's, you know, one or two studies about bringing cancer patients into nature. But when I looked at your website and I saw what you were doing, it seemed like you had this amazing concept for not only bringing people into nature, and I'm a mountain lover, so anything that involves mountains makes me very happy. And I can imagine it makes other people happy too. But so bringing people into nature, giving them challenges, giving them opportunities to serve, because you do service as part of your trips, but also doing it within the context of structured group support, where people can connect with other people, can talk about their challenges, can talk about everything that they're going through. And that just seemed like the ideal setup, like the ideal chemistry and catalysts and whatnot to support people in growth. And so I wanted to see how it worked. And then I think you invited me to a gathering that was being done on somebody's back porch south of Des Moines. Um, and I talked to people who had been on these journeys, and and people were, just were describing them as life transforming journeys. And so to me, it was like an optimal opportunity to see, well, how does this work? What happens here?
And so as we collaborated and decided how we were going to, from a scientific perspective, investigate this to determine what's happening and what extent of transformation happens. Go through your scientific mind. How did you design the study to do pre and post trip assessments to come up with a valid scientific conclusion about what happens psychologically?
Well, so we did two things. We asked people, we gave people some validated questionnaires that they could do online, and specifically looking at things like anxiety and distress. And then what turned out to be the most interesting was specific qualitative questions that we asked people. Um, and I'm just going to take a look and see if I can. Yeah. So some of the kinds of questions we asked people were, what led you to go on this journey, and what were you hoping to learn from it? And what was your most surprising experience? What was your most touching experience? What have been some of your most important insights? How have you changed as a result of the journey? And how can you keep that change alive? What was the most challenging part of the journey? And so we found that in these questions that we asked people before they left, when they came back, immediately after they came back, within the first 2 weeks, and then 3 months later, that was where the real meat of what we were interested in seemed to emerge, where people were talking about what was important, what they noticed, what happened to them, and that's what we were looking for. And so that was one of the important qualitative parts that we found.
And maybe I'll invite you to expound a little bit more on the paper that was published this year that demonstrated growth and resilience in the individuals that that went on the trips.
Okay, so I can talk a little bit more. You want to know how many people were on it, or what
Yeah,
we did?
just what do you think is the most interesting aspect of the paper? It obviously was published in a peer-reviewed journal. It gave me great joy to see this publication and the use of above and beyond cancer in the title of the medical publication, and along with the word resiliency. And so obviously, going through the validated surveys pre and post, and then also looking at the qualitative, you found a positive correlation between
Well,
positive. Go ahead.
so so first, I think I'll say I had 2 graduate students and 3 undergraduates working on this who were helping. What we do is all of the qualitative responses, we code them. And there's a very sort of, I won't say strict, but a very careful attention to coding, ranking qualitative responses, and coming up with themes that people are talking about, things that we hear again and again. And, some of the interesting things that we found is that there were people who said, this is the weirdest thing, the craziest thing that I've ever done, but I knew I had to do it. It was so important to me. I needed something different, something new to happen in my life. And so, and I surprised myself by going on this. So I think what I should say is that we looked at 3 different above and beyond cancer journeys. The first one was to Nepal, and it occurred right after there had been an earthquake in Nepal and Tibet. And so the group had been going to do some mountain climbing, but instead they had to restrict their activities to Kilimanjaro, to working in a medical mission in not in Kilimanjaro, in Kathmandu, right?
Yeah.
Sorry, another K word. And the second one was going to Mount Kilimanjaro and also doing a medical mission in Kenya at that time. And the third one was going back to Kathmandu, working in a hospital in Kathmandu, but then going to do the circumambulation of Mount Kailash in Tibet, which is now part of China, which goes up, that circumambulation goes to 18,000 feet. So anybody who thinks that this was like a hop, skip, and a jump is wrong, because I know these are really, really challenging activities that you had people go on. And so one of the things we found was that, in fact, maybe if you could show my first and second slide, I can describe some of what we were seeing. So if you want to show the first slide, that'll give people an idea of where you guys were. Yeah. So in fact, Dr. Deming, if you want to say what people are seeing here, you've been there, I haven't.
Yes. So we've got down in the lower right corner is Kilimanjaro. Above that is Machu Picchu. In 2015, we did up and over the Andes Mountains to Machu Picchu. And
Which
then
we didn't study, but it's in there because it's a great picture.
yes. And then the larger picture on the left is from the Himalayas. And I'm not sure exactly where that photo is. We have done several treks in the Himalayas. And as you mentioned, in 2018, we actually did 103 miles of 80 miles of up to the Tibetan plateau, crossing over the Tibetan the boundary, and then up to go all the way around the 30 miles around Mount Kailash up to 18,000 feet. So that's one of those Himalayan trips. And
Okay.
yes, and
So
so very challenging physically when you're at altitude, going that many days in a row and that many days of hiking difficult, steep terrain.
exactly. So if you want to go to the next slide. So some of the things that we found as people were talking about what had happened to them, we found that in putting together what were the components of growth and resilience, one of the first things was that people were having new experiences and they were in unfamiliar terrain. They were learning about another culture, and they were, in a sense, learning about another culture. They were divorced from their normal cues of what do you have for breakfast, where are you sleeping. People were around them. It was a different scenery, people talking in a different language, and so many people mentioned people being kind to them. So many of the people on your journeys talked about the people from Nepal, the people from Tibet, being just so kind and reaching out to them. People also talked about physical and emotional challenges that they were having. Certainly, the physical challenges of these hikes were just tremendously demanding. Um, People talked about conquering their fears, afraid that they weren't going to be able to last. They didn't have the strength to do these journeys. Um, Appreciation of nature. You went through some of the most spectacular nature scenery in the universe, in the whole world. And so, people can't help but be awed by that. And often people talked about a sense of accomplishment. So all of these went into what we called new experiences. And then, if you want to show the next slide, okay. So those new experiences were really experienced in the shared crucible of being connected to other people. People shared their experiences. If they were having a hard time, if they were stumbling on the road, on the trail, somebody else would reach out a hand and help them. People wrote in diaries, they talked to other people, and in their qualitative work, they talked so much about the importance of being with other cancer survivors on the journey, other people who understood exactly what they were going through, their limitations, their hopes, their fears. And there's something about that sense of connectedness that enabled all, all that was going on with the new experiences to emerge to an area that we called new perspectives, where people could look on situations from a different angle. And if you put on the next slide, and that those new perspectives were what led to things like growth and resilience. And when people described growth, they talked about growth in themselves, in their own perspectives, but also they were taking better care of themselves. They had a very strong desire to come back to the States and help other people. They felt a call to action. Some of the people talked about finding ways to continue to help those patients who were less fortunate than they were, and being in cancer hospitals in third world countries, and find a way to help them. And and in terms of resilience, people talked about finding inner strength that they never knew they had, that they could then come back to their lives in the States and know that they had that inner strength to deal with their own survivorship.
Yeah, as you're describing all of this, it's the exact same experience and consequences that I hear patients tell me as they've gone through their cancer journey, who haven't gone to a mountain with me, that they come through this difficult cancer journey with where they're suffering, but where people are helping them along the way. They're so come through so grateful for the help they received, not only from the professional caregivers, but from their family and friends. And they gain a better appreciation for this strength that they found within themselves. It's not like cancer or climbing a mountain gives you strength, but it allows you to realize the strength that is inherently within yourself. And
Yeah,
then the consequence is number one, because of the gratitude, you want to help others.
right.
You want to pay it forward. And number two, because you have found this strength that's within yourself, you're willing to actually intentionally put a bump in your road of life. Sometimes a mountain falls out of the sky unwanted, like a cancer diagnosis, but sometimes we put a mountain in our pathway, a real mountain, or a triathlon, or we go to graduate school. We realize we have this strength and we can take on challenges because we know we have this strength. So I see both
Mhm.
of those things, the gratitude and desire to pay it forward, and the
Exactly.
willingness to take on a challenge because we found this strength within ourselves. And I see that with individuals who come through the cancer journey with support. And I obviously we've seen it, and you've demonstrated it scientifically that it happens to those individuals who go with us on these transformational journeys up into the mountains.
And I think one of the things that is really that you can't underestimate is the value of social support, is the value of connectedness. And one of the things that we've seen in our other research that is looking at the biology of cancer is over and over again the most powerful thing in um, that's related to lower levels of tumor aggressiveness and all the pathways related to tumor growth is social support. There's something about feeling, and it's not just that you have somebody who can bring you chicken soup, but it's feeling like you have somebody at your back, feeling like there's somebody that gets it, that will walk this journey with you. That's what that's what people endorse over and over again as so important, and that emerges as related to biology.
As you describe that, and then as you're describing some of the qualitative experiences as they relate, you talked about the shared experience, and I wonder if there's a connection, or if they're part of the same process. This social connectedness and this shared experience. So, for example, as you were describing it, I think of my own. Uh, when I'm out in nature, whether I'm skiing or whether I'm climbing a mountain, I personally enjoy doing it with someone so much more, whether it's, sharing this beauty, this vista you're seeing. And it's like, I kind of sense when I see it by myself, it's like I don't experience it as fully as when I'm
Yeah,
sharing it with
you want
someone
to share
else.
it. Yeah.
And the same thing, like, I'm skiing down a run, and I feel the joy, but it's the magnitude of that joy is always increased when I'm sharing that experience with
Mhm.
someone else. I wonder if the social connectedness that happens when someone goes through a cancer journey is similar to the shared experience in nature.
The one thing that jumps to my mind to in thinking about that is when I came to your group that you had at the YMCA in Colorado, and it was a fellowship group that you had of people who were sharing after a day's hike in Colorado. And what was happening there was that people, it seemed like people's experience was deepened by talking about it. And also, people had the sense of, oh, I'm not alone. I'm not the only person that was stumbling by the time we got to 8 miles. Somebody else was stumbling too. And that's all right, because it's all part of this. And so, some of this is sharing, some is social comparison, some is just the joy of going through an experience like this and having somebody else get it. And that getting it is just like it just helps you let go of this and go on to the next thing. And
Yeah.
it makes it deeper.
As a cancer center director, what I really hope every patient who goes through the cancer journey, obviously you want the best possible outcomes, but you also want to make sure that as someone goes through the cancer journey, that we're providing all of that social support, the paying attention to obviously the physical symptoms, but also all of the psychosocial support,
Yeah.
financial, mental health, and that by providing all that support, that as someone comes out the other end of that journey, they're not facing post-traumatic stress. They
Yeah.
actually come through the cancer journey with this sense of post-traumatic growth, that they've actually come through the journey with a greater sense of who they are, of gratitude, and their own strength.
Yeah, and I think one of the things that we've seen is that, and I'm sure you've seen this as well, is that sometimes people feel like they have a lot of social support when they're in in a situation when they're actually going through active treatment. They see the nurses regularly, they see the doctors regularly, and then when they finish active treatment, they feel like they're led astray or some not astray, but it's like people aren't monitoring them as carefully, and they've lost the people that were cheering them on. And so that's really very often a time where people need additional supports to help them manage what survivorship is all about. And you do an amazing job of that in your programs at the Y. And those are the kind of things that create connectedness and help people go on to the next steps.
Yes. Yeah. I mean, you raise a very important point that when someone's going through the active cancer treatment, they're seeing so many people that are validating that things are going well and you're doing well, and then you're done. It's kind of like a little bit like postpartum blues. I mean, and it's also a little bit like having run your first marathon and you're done with the marathon. And it's like, oh, okay, now what do I do?
What
This
do
was
I do
gonna
now?
be a
Right.
one and done, but now I've got emptiness in my life. Do I just sign up for another marathon? And so how do we
No,
provide
go around Mount Kailash.
you're right. And the other thing though with going through the cancer journey is, when you're going through the treatment, every day you're actively doing something that is intended to get rid of your cancer. And then
Right.
once the treatment's over with, it's like, oh, I hope it worked because I'm no longer doing anything actively to fight the cancer.
Yeah, exactly.
So that's one of the just one of many issues that cancer survivors face having gone through treatment. I mean, there's physical, psychosocial, philosophical, spiritual issues, and financial issues that
Hmm.
many cancer survivors face as a result of the cancer journey. Was there anything that surprised you as you and your research team looked at the data, both the validated surveys and the qualitative information?
I was surprised by some of the some of the people were just like kind of fresh out of treatment when they went on the journey. And I was thinking, I hike a lot, but I don't know that I could have either summited Kilimanjaro or done that 100 and whatever it was, trip that you did, in addition to the 30 miles around Mount Kailash. And And I was really blown away that that everybody was able to make it. That
Mhm.
was just really amazing.
Yes, it is amazing. I know of groups of college athletes that have done Kilimanjaro that had like a 75% success rate. And the last time we went there with 30 cancer survivors, some in their 70s, and 4 of them with incurable cancer, and all but one made it to the summit. And there's something to be said about that, having a common purpose in this.
Yes.
You know, the athletes that fail, it's usually because they're just going too fast and they're just
Yeah.
not thinking they're infallible, and they go too quickly and get into altitude sickness problems, whereas our group all taking care of one another slowly up the trail, we have an incredible success rate in terms of the number of individuals that actually make it to the summit.
Hmm. Hmm.
Yes. Where would you like to see, in terms of research on further research on individuals that are on our journeys? Is there a second phase? Is there at one point we were uh, doing cortisol levels of saliva
Hmm.
pre and post one of our journeys to see
Right.
for refresh our memory, what were we hoping to
So,
see?
so we look at salivary cortisol to look to do stress to look at stress hormones, and what we what we found with that was, first of all, people, there weren't that many people who wanted to do that, and there was such variability in it, and I think that is um, just from the rigors of the journey, and the kind of changes that happen in, in people's circadian clocks and in their metabolism, going to the other side of the world and going on a journey like that. Um, I what we found was that there was really too much noise in the biological measurements, and so that that made the results that we had, even though it was not on that many people, kind of uninterpretable. We're using another methodology now in some of our other studies, which is a finger prick, and you put a finger prick on a little blood spot on a piece of filter paper, and with that, people can do like they can look at immune factors, they can look at genes that are turned on and genes that are turned off, um, and that might be another way to approach looking at the biological side of what is happening with people on journeys like this. And I think what I would do if I was doing something like that again, I would do a pre, and I would do like, are there changes maybe a month post or 2 months post rather than immediately post.
Okay. And Susan, I know that you are doing a study there at the University of Iowa is it with ovarian cancer
It is,
patients?
yeah.
Could you tell us a little bit about that study?
Sure. So what we're doing is, exactly what we were talking about before, about what what happens when people finish their primary treatment. How do they reintegrate into survivorship, and what important skills and knowledge do they need to have as part of their survivorship? So we're doing a study at the University of Iowa, which is actually a study that's being done on the web, so it can be done by anybody, anywhere. It's for ovarian cancer patients. It's called Living Well, and there are two conditions. People are people either participate in groups that are teaching them specific stress management skills that have to do with coping, quality of life, social support, how people talk to themselves. It talks about stress and stress management. And the other condition is a group in which people are having education about important things related to survivorship, like nutrition, exercise, um, cognitive complaints. And if you want to show the next slide, I can show a slide that's a little bit more about the study. So all of this is something that can, all right, so the study is called Living Well. And all of this is something that can be done from somebody's own home. So we have a mindful living group that focuses on strategies and techniques for managing stress, coping, and social support. And the Healthy Lifestyles group is what's focusing on nutrition and exercise and sleep. The groups go for 10 weeks. They're 2 hours a week, and they're either led by a psychologist for the mindful living groups or a health educator who's leading the healthy lifestyle groups. And the mindful living groups also teach relaxation skills and mindfulness skills and imagery skills. And if somebody, so people are in the groups for 10 weeks. The groups are 2 hours a week. It's all done on, just like we're on a virtual platform right now, it's all done on a virtual platform. If people don't have iPads and are interested, we can supply people with an iPad. And I guess I should say, if people are interested, if you can flip to the next slide, I think I have phone numbers on there.
Yes.
Yeah, if somebody is, again, this is for ovarian cancer survivors who are between their primary treatment and 5 years post-treatment. And what we're really looking at is trying to see if having some of these skills, either educational, informational skills or stress management skills, help people do exactly the kind of things we've been talking about without going to the mountains. You know, within the context of social support, do these groups help increase quality of life, increase growth, increase transformation? So if anybody's interested, here's information on how you can get
Great. So there's the phone number, and any woman who has been treated for ovarian cancer, has either just completed treatment or is within 5 years of completing treatment could participate in the study. And there's the phone number. And so hopefully anyone out there with ovarian cancer that's interested in participating in this study, this would be a great opportunity. You know, I think we're going to open it up to questions. So we've got a live studio audience here, and we also have many people that are watching live streaming. So we'll open it up to questions. If you are watching us live streaming, please put your question in the chat box. And we've got a microphone here, so we'll open it up to questions. I have a question here from George.
Well, it's not from me. It's from a viewer. Lori says, so you did research on persons with cancer. They went one of the AN Above and Beyond Cancer trips to test resiliency. What studies have been done on persons with cancer who don't go on such trips to see their resiliency pre- and post-diagnosis treatment? Maybe comparative, I suppose, yeah.
Okay.
So I don't think there have been studies specifically about have people increased in their resiliency from the beginning of cancer to once they're done with treatment. I think what's more common, and there may be studies that I don't know about, what's more common is that there are a number of academic medical centers that have group interventions for cancer patients. There's, for example, Ohio State, University of Miami, UCLA, where cancer patients participate in group interventions, and then I won't say resilience, but well-being is measured before and afterwards. Um, and these kind of interventions have been shown to definitely increase well-being, decrease anxiety, and enhance overall ability to deal with survivorship.
Okay. Thanks. Another question?
I know the university has a wonderful program, and I have pretty high anxiety. I think I was probably born with it. And I understand that, maybe in your profession, there's different levels of treatment. And how do you, as a doctor, determine whether a person, can benefit just by more talking with their friends and having their physician, or when they need to, step it up a little with a psychologist, psychiatrist? And then I think you have an inpatient program tied to neurology that's, as I can remember, I think it's rated among the top 10 in the United States, and it ties in the mental portion of it.
Okay, well, so those are really good questions, and I've heard it said that some people are born with anxiety, just like some people are born with blue eyes, and so I think one of the criteria is, many times people will talk with their friends about an issue, and they feel like they really haven't, that they're talking about the same thing over and over again, and they really haven't learned new strategies for dealing with anxiety. There are some wonderful, wonderful psychological treatments for anxiety, and so if you're in a situation where you feel like you've talked to your friends, you're getting support, but you really haven't learned new skills to deal with the anxiety, that's the point at which to look for some professional help, whether it's from a psychologist, whether it's from a psychiatrist or a social worker. And they can help determine if therapy is going to be enough, if you need therapy and medication. There are a number of approaches, and it depends on what kind of anxiety, what the anxiety is about. But there are some very helpful approaches, and I would, urge you to reach out and look for some support like that.
Great. Thanks, Susan. Other questions? Any questions on the chat box? Okay. Well, I think we're going to wrap it up, and this has been just wonderful to spend an hour with you, Susan.
Well,
And
it's been wonderful to spend an hour with you.
And any of you that are watching this live and know of individuals who would benefit by watching this program, tomorrow it will be available on demand at the YouTube, the Above and Beyond Cancer YouTube channel, and it will also be available on demand at the Mercy Cancer Center website. So thank you, Dr. Susan Lutgendorf, for joining us. And thank you for all of the collaboration that you have done with Above and Beyond Cancer over the last few years.
Well, thank you. Also, it's been lovely talking with you.
And I invite everyone to join us again next week for our cancer education series. Again, this program is brought to you through a grant from the Rosalie and Sherry Exline Ziegler Fund. And I hope to see you all next week. Thanks, everyone.